Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gawain Vaughn.
Sounds good.
Welcome to the Auburn Medical Group with Dr. Mark Vaughn, but also you get bonus this week.
I'm back.
Dr. Gawain Vaughn has returned. So please show him love through the super chat.
Yes. Thanks for having me.
Yeah. Are you refreshed and ready to do it for another 10 years without a break?
Sure.
Okay, this will be great.
Man, I don't get like a 7-year hiatus like pastors do, like they get there.
Well, last year you got that.
I did get that. That was nice.
You got your sabbatical.
I did get my sabbatical. That was very good.
So last week we talked about a subject, and you probably remember better than I do what it was.
Actually,
because
I was out of town. I
didn't
even have my phone on.
It was a good topic. I had slides, and there's a whole outline of information on the description that goes with the video, and
it was so good. You'll need to check it out.
You weren't here, so it wasn't memorable to me. I mean, it was a great show. Really good information for our viewers. But today we're talking about gallstones.
Yeah,
which was all the news.
July 3rd.
Well, for me it was July
4th when you were with family.
I think I may have heard of July 3rd, possibly. Did you tell me?
No.
It was either your mom or your dad then.
Like I said, I was out of contact.
So we'll let you in on it. Somebody had gallbladder surgery. And so that's why that's the topic today, because 4th of July, with all my cousins and everybody, all the relatives, the subject was gallbladder and gallstones and what it and I got to hear some people explain it, and it was close. They were close.
it was medically accurate.
As happens at your family gathering. So we're
here to make sure you talk about are completely informed for your gatherings.
Those who are related to us and know that we do a show, because I told some people we do a live stream every Monday at 4:30 on this channel. Okay.
We're here.
So we're talking about gallstones, and we'll get to that. We also are having this is a live stream, so we have a chat. It was already going before we got started.
So if you're watching this in pain from your gallbladder, fast forward a couple of minutes, then you'll get to the part where we actually talk about what's going on inside you.
Somebody it's like 2 years from now. Somebody goes on YouTube, what are gallstones? I think that might be what, and they're just hurting us. We're joking around.
They're just talking.
Awful.
It's like they don't even care about my pain.
Where's the empathy, doctor? I'm so sorry. So this is actually a show more about laughing than
which probably hurts if you're laughing right now with gallstones.
Actually, if somebody's watching this after the fact and they're having acute pain somewhere in their body, please call 911 or call your doctor or go to the emergency department. Don't go to YouTube.
Do not rely on us, random doctors on the internet.
There, that was our disclaimer. That was it.
Diagnose you and tell you what to do, except see your doctor. So, because true cholecystitis
is a medical emergency and does need to be acted on, and can't wait for let's just see what happens.
Yeah.
So we'll get to that. We'll get into that. We have some comments here. Should I
sepsis? Let's just.
So we bring up the chat.
This out.
The chat is active and it's waiting for the chat because I haven't told who to.
Yeah.
Deborah says hi, and Laura says hi, everyone. And Robert Antonio says hi, doctors.
Hello.
And of course, hello to all of you.
Thank you for joining us.
So let's start.
And if you have questions about gallbladder disease or stones, put them in the chat.
We will let your questions guide us as you're having your acute abdominal pain now.
Yes.
Not years from now when you.
We won't answer it.
When the algorithm.
Hopefully we've answered it in what we talk about. But anyways.
Okay.
Gallbladder pain. What is a gallbladder?
And Lindsay's here too. We got to say hi.
Hello, Lindsay. Thanks for joining us.
Hello, Lindsay. All right. And Robert Antonio says anticholinergic sauce. Oh, that was a good one.
That's what you talked about.
That was a good show. The anticholinergic show. It was good.
The anticholinergic show.
Yeah.
That sounds like yeah.
Yeah, it
sounds like a good time. Man, I missed out.
Well, with hallucinations and
talk about all the good
hyperthermia and
lots of cool things happen. uncool things happen with anticholinergics.
Urinary retention. Yeah.
Oh.
Yeah, that's pretty neat.
So, stones. What's a gallbladder?
Okay. Where's our
Hey! Pull apart, Patty.
pull apart? Can you see
Patrick?
Can you see the liver here?
Yeah, they can
Let's
see
pull the
that.
liver out. Oh, look at that.
That's a liver. And what's on the lower side of the liver? A green thing.
Here, let me put it in front
So
of your face.
here's the thing. It is actually green.
Oh, it actually is.
Yeah, like
Most
when
things
you're
aren't
in
the
the lab
colors.
dissecting it like we do in medical school, it's green.
Behind. Let's put the liver where it would be on Dr. Gling. Oh, maybe we should go to there. Let me find your ribs.
Get it up under there. Oh, you can't even see. It's too low.
No, you're too tall.
It'd be right up under there.
Yeah, a little bit protected, but ribs would be across.
The ribs are right here,
The
so-
ribs are coming across the top
protecting
of
it. If you kind of take your fingers and
Ribs.
hook the bottom of your ribs
Ribs.
up under there, those are ribs. You can't really see. What? Get away from me. Anyways, that's where the gallbladder is. It's essentially, bladder's just a, pocket that holds a liquid.
I used
so
to change your diapers. Okay, moving on.
walk out right now.
Anytime someone says that, just walk
I'm
out.
leaving. And back to a gallbladder.
Okay, please bring us back on.
It's just a sac that holds liquid. In this case, bile is that liquid, which is that green stuff. It is actually green, but it's a storage area for bile. So that's what the gallbladder is.
We'll get more
so
into that.
where does it sits right under the liver because the liver actually manufactures the bile and bile salts, as they're called, that are in there.
I didn't show that, but
That's the liver. Yep.
liver has this big blue thing here is representing a very large blood vessel with lots of the blood circulation that, there's one that just kind of goes up through, which is a little smaller, and then the bigger one out top. Why? Because there's two that join together.
Yep.
Yeah. Anyway, so the liver is filtering blood,
Yes.
getting what the ingredients of bile are out. They go through special ducts to get
Yep.
into this green duct here we call the bile duct and cystic duct.
Cystic duct.
Bile duct,
yes.
cystic duct,
Goes
and
in,
then- and what's
that
this one
and
called?
joins up with the hepatic duct to make the common bile duct.
Yeah, this is the common bile duct down here. This is the hepatic duct. This is cystic duct.
Yep.
You can't see them because it's too
Yeah, it's
small.
hard
but
to see.
trust
Pancreas
us.
comes in there too with the pancreatic duct. And those empty into the small intestine, the first part of the small intestine called the duodenum.
Or duodenum, depending on who you are.
Depending
So-
who taught you.
This here is kind of a dead end. It comes off of, imagine a duct just moving along, carrying bile, which is a liquid, just stuff coming along, and then off of it is this dead end duct, which fills up with the stuff coming through, and then when it needs to, it squeezes it out, and it goes. It's one direction. It's supposed to be
Right.
one. Supposed to be, unless you have ascending cholangitis.
Right.
Supposed to be descending.
Yes. Yes.
That's why they call it that. That makes sense.
Yeah,
now.
but anyways, the gallbladder has muscles in it that allow it to contract and push out that bile into your
Intestines.
small intestine.
What for? What's it do?
So it actually helps with the digestion of fat. So that actually can get us to some of the symptoms. Or risk factors, maybe better thing. So fatty meals, because fat can stimulate gallbladder contraction.
Are we going to be politically incorrect and go over the 4 F's?
Yeah,
Or we're gonna make people look it up.
The
You
4
look it
F's
up.
are overweight, women who can get pregnant, who are
Google it. 4 F's gallbladder.
Yeah. So that's how you remember it in medical school. In this case, it wasn't. This person did not hit.
Well, let's see.
Many of those.
This person's wife was pregnant.
His wife was pregnant.
He's not as svelte as he used to be.
Oh man,
He's not quite 40.
not quite.
His wife's pregnant. I already said that, didn't I?
Yeah. You can go through the F's in your head. Anyways, those are the risk factors. Women over 40.
So he didn't really
Overweight.
fit the typical constellation of risk factors.
Yeah.
I don't know if he had
Yeah.
eaten greasy food before this all got
Typically
started.
about an hour before this pain
Do you know
really
how he
comes
usually
on.
eats? Have you observed how he normally eats?
I would not call it vegan. He's gonna watch this afterwards and be like,
I know, he's gonna kill
guys, come on. Yeah, I don't know. Maybe he had a fatty meal. He came home from
How many of
had all those
those?
fries from In-N-Out.
Yeah, I think he likes those. How many of those? What are they called? Cake pops?
Oh, gee.
Did they have left over?
At the gender reveal
with
party.
pink. With pink.
Pink. Now the whole world knows you're having a
Well,
girl.
yeah, they had a party, so
I guess the word is out.
they don't know who.
Anyways, those are the risk
This
factors.
person's completely anonymous.
Yes.
We have not said their name, nor how they're related.
Nope.
Oh my goodness, Laura Barzyk. What? Hold on here. This is.
Can you put up her chat? Because we gotta say that. It says you both are hilarious, informative, but hilarious. Not and.
Like
not
I said.
informative and hilarious. Informative but hilarious.
Dial 911. Do not come to this YouTube channel with your emergency,
Hey.
because we'll just make you hurt.
Now I'm just reading a comment here.
Okay.
It says fat, 40, fertility, and fair.
Wait, who's fair?
That's not the
What's
one I
fair
learned.
mean?
Yeah.
What's fair? What's fair?
Females.
It's
is
not.
is the fourth
Nothing's
F.
fair.
Nothing's fair in life.
Nothing's fair.
Gallbladder stones. Gallstones
mercy,
are
no
not
dignity.
fair.
Okay, so she
Anyways.
says in England it's fat, 40, fertility, and fair.
Yeah.
So what's
Fertile.
so what's
Yeah,
missing there is female.
is that.
And
the
female
fourth F.
truly is. That
And
really
risk
is.
factor happens much more
more often
often
in women
in
than in
women than in men.
And
yeah.
so Robert Antoni's impressed with Laura. Once again, Laura,
We are impressed. Thank you.
$49.99 super chat helps.
appreciate it.
Helps to get us some Dutch Brothers,
Yeah.
which because of the
Which
caffeine makes us more entertaining
Makes us
for Laura
much
Barzyk.
more informative and hilarious.
I thought it was butt.
Well, she said and. She said meant and.
Informative but hilarious. You're
Don't
You
go there.
both are hilarious. She doesn't say you're both hilarious in form. She says you both are. Oh,
Hey.
I thought I was the funny one. Apparently, it's the combination because she didn't say that last week when you were here. See, now she's making you feel like
Hey.
people actually do appreciate what you do.
Yeah, I feel so loved.
Okay.
Anyway, risk factors. Let's talk about symptoms. Gallbladder pain is typically in the right upper abdomen. We call it the right upper quadrant, kind of right under the ribs. If you kind of hook your fingers up under
I
the
was
ribs,
trying
that's
to,
where
but
the pain is.
you almost
can
walked
feel
out.
my ribs. Not like some.
If I
some
had a
people,
dime for every
not like
time
a
somebody
not
says
like a
that to me
different
on the
sibling
street.
where you can see his ribs, but
He's growing out. He's filling out.
he's filling out.
Obviously, not the one who had the gallbladder.
Anyways, so yeah, that the gallbladder's right up under. They're gonna know something about every member of my family now. All right, let's talk about the bald one.
We're just he is suffering from acute baldness.
Every single one of my brothers is gonna watch this and be offended.
Acute baldness, because that's when all the hair fell out from when he was cute.
It's a cute
What's left is
not cute.
baldness.
Anyways, right upper.
I have it
quadrant
too.
pain.
That's why I can joke about
That
it.
pain comes on right about an hour after eating fatty meals.
Oh, it's not that long.
30 minutes.
I don't know. I've never experienced. Thankfully,
I've never had it either, but that's 30 minutes an hour. It's
So
it's long enough that you've eaten, it's getting in there, and your body's starting to contract to try to push out that bile.
Yes. So
it's
moving on from the stomach to the duodenum.
Right.
Or duodenum.
Yeah.
So it's not immediate when you swallow it into the stomach.
Ow! No. Yeah.
A little bit after.
Okay.
Yeah.
So the other thing is there's a little differentiation between what we call acute cholecystitis, which is the thing that needs surgery, where your gallbladder is like inflamed and thick and needs to come out, versus biliary colic. Biliary colic is different. Biliary colic is that right upper quadrant pain that comes and just reaches maximum about 2 hours out, and then slowly goes away. So it kind of just comes on after that fatty meal, then goes away. Whereas acute cholecystitis, where you need to go to the ER and get it evaluated, just keeps getting worse. And it is usually accompanied by other things like fever, nausea, not wanting to eat, all those things that kind of come with you're getting sick. So.
And if it's really, really bad, you can even have the yellowing of the eyes and skin.
Yeah, you can actually block
Jaundice.
bile flow and get jaundice.
Yeah, if it totally blocks the
Yeah,
flow.
if you get that stone kind of down in there,
Yeah.
blocking. So now, how does that happen? Kind of what's the idea behind it? The gallbladder can sometimes develop stones just from stagnant bile in there, and those stones can start to go in and block the outlet. So you're pushing against this thing that doesn't want to move, and then that starts to cause pain. Now that can cause biliary colic, where it goes in there and then it slowly falls out, and you're better. If it goes in there, it gets lodged and gets stuck, and you're just pumping against something that ain't gonna move, it just gets worse and worse. And that's where it starts to get thick and inflamed.
We will have a game after a little bit here where Dr. Mark and Dr. Gawain try to come up with as many stones that can get stuck in the human body as they
Ooh,
can.
this sounds
But we'll
fun.
get to that later.
That sounds really
So
fun.
he mentioned cholecystitis,
Yeah.
which is when that thing is blocked and there's bacteria in there and it starts to get infected. Gallbladder has to come out.
Yep.
Those you don't treat with watchful waiting and
'Cause
antibiotics. Those you take out.
It can burst. You can
Yeah.
get sepsis. You can get
Yeah.
infection within the abdomen.
Another term, though, is cholelithiasis.
Ooh, lith.
Litho referring to stone or
Stone.
rock. So it's a stone.
Yeah.
Meaning that the person has a stone in the gallbladder system, cholelithiasis. That doesn't have to...
in itself.
You don't have to
is
operate on
not
it.
necessarily a
You
problem.
can carry those stones just like... Who's carrying stones around?
Somebody had
Sandra.
200 of them.
Over
200.
So you
That's a
can
lot
carry
of
those
stones.
stones around,
But you can live with those for life.
and maybe you'll have pain sometimes
Not
when
necessarily
you eat.
a problem.
Like you said, the biliary colic that comes, eventually goes away.
Right.
You're not having a fever. You're not infected.
Yeah, having those stones obviously puts you at slight increased risk of having cholecystitis, the one that needs surgery.
Yes. And some people have surgery just for
Right.
cholelithiasis because they're done
Right.
with it and they're tired of trying to eat.
Yeah, or it
a
just
certain
keeps
way,
coming. Yeah,
or it
you do have
happens even when
those.
they're
It's
eating
not
right.
an emergency in that
Yeah.
case. We refer them to the surgeon. The surgeon evaluates it. So typically, how are these found? How do we make this diagnosis? First of all, the story. If somebody comes in saying, I've got this pain right here, came on, 30 minutes after I ate at McDonald's.
Might radiate to the shoulder.
or right through the
might
back.
radiate to the middle of the
sometimes.
back.
That's a pretty good story, and that puts us on high alert, but we usually need confirmation. The way we confirm it is with an ultrasound.
There you go. You just see them on ultrasound.
Yeah, so you can see the gallbladder pretty good with an ultrasound. They can do it right in the ER, actually, right at bedside, and see those stones. They look like little round stones. You can see them right there. Up to 200 of them.
Yeah.
That's amazing
not
that
sure
they
how you count that many
I was just going to say,
individual
that's
stones with
amazing that they were able to count
really
that.
high
They probably
resolution
just saw
ultrasound.
so many that they were like, 200. Give or take.
They'd be pretty small.
Yeah, that would be a lot.
Yeah.
So it's ultrasound. Now, that's not always confirmatory. Sometimes there's sludge in there, or it doesn't have that thickening of the gallbladder. Those are kind of what we call pathognomonic, or the thickening, especially. That's saying that something's going on and it needs to get out. There's another study called a HIDA scan that can be done if that ultrasound is not confirmatory. And that's where they actually measure the ejection fraction, or how well the gallbladder is getting out bile. That's a little, we won't go into the details of that, but that is something that can happen. What are you just putting up things now?
I just love this one. Laura, we love it.
Informative.
Did you see that somebody gave us what does fair mean?
What does fair mean? And then somebody said blonde. Oh, wait, what?
Because we were talking about 4 F's and one of them was fair.
It's not fair.
It's
At least that's not
it's not fair.
what we learned. She says
not
England,
fair.
Sandra
It's
Craig.
not fair. There's no dignity and there's no mercy.
And then somebody said,
Those are jokes.
oh,
jokes that
fair
people-
as in like blonde. That's what she was saying.
Right. I don't think that's what it is.
I have not heard of that as a risk factor.
Blonde people being a risk factor for...
I've not heard that. I mean, I know plenty of other jokes that can stem from that, but we'll avoid those.
We're going to get in trouble. That's okay.
That's okay.
I've had a good career. I'm ready.
Yeah, you're just ready to hang up the stethoscope.
Okay, let's get to Laura, because Laura's very special. Let's get to her comment. My mom bought her gallbladder. No, my mom brought her gallstones home from the hospital.
Awesome.
Think
make
they're
a great
still somewhere in the
necklace.
house. Scavenger hunt for the next family get-together.
That's awesome. That sounds great. I mean, if there are enough of them, you can put them on like a pearl necklace. If you have 200 of them,
Make earrings.
make earrings.
200, make a whole necklace.
And then a bracelet. Man, you'd have
There you
a.
go. People do it. People make gallbladder jewelry. It is a thing.
They'd be pretty
I'm
green
sure if you
color.
Google for it, you'll
like
find
an
it.
emerald color. That'd be pretty. Anyways, can they pass? Mitch Owens asks,
They
or they
can't
can't
pass?
pass? Question mark.
Asking? They can't pass?
Well, it depends on the size, like anything. So
Sometimes.
sometimes they can. You'll kind
So,
of have pain through it.
When they hit the toilet, do you go dink?
So yeah, maybe we should clarify between stones. Like a gallstone is different from a kidney stone. A gallstone goes into your.
Oh, okay. So that's going to be one of your stones on our
There you go.
competition.
Kidney stones.
Okay.
So
We're not done.
So people can make that. I often hear people make that confusion between gallstones and kidney stones, saying, "Oh, I got gallstones. I just got to drink more water." Yes, the hydration it can help anything, but it's not like a kidney stone where you're just filtering water through it and you're able to kind of dissolve it a
You
little
sure
bit.
you were in
there.
it 4th of July?
So it's a different thing. There are all sorts of at-home remedies on the internet. If you look them up for gallstones, mix a tablespoon of olive oil with
Lemon or wine.
some sort of citrus,
And do it 3 days in a row and fast. Don't have anything else.
Right. That just sounds painful.
So-
I have not heard of. I don't know of any research confirming that it is
I have
one of those.
that one you're talking about. I have had patients say it resolved their symptoms. I think somebody got an ultrasound afterwards and it confirmed.
I mean, it's
Cells were gone.
you're putting oil in your body. That's a fat, so it is going to contract
it's
that
going-
gallbladder,
yeah,
trying to push it out. And if those stones, so it's going to do one of two
I'm
things.
a little worried that
It's either going to throw you into a nice gallbladder attack,
it may cause.
or just or pass it, maybe. But yeah,
But I didn't hear them describe a painful passing.
they didn't. That's
I
what
don't know.
that's what the lemon
That's
juice
the
does.
magic of.
That's the magic. I don't know.
I don't know.
So there's your
But
next
we do
research project.
we do encourage not jumping straight into surgery because we don't
Right.
like people to have surgery when they might be able to avoid it.
Healthy eating
Yes.
is one area
Yes.
here that is important, trying to avoid those fatty foods, which are not good for you anyways.
So are we going to tell our relative not to go to In-N-Out anymore now that it's out? I mean, what good does that do?
He doesn't have a gallbladder now. And now it's just going to stimulate the bile flow without, without any storage.
So let's talk
it'll
about
give
that.
them diarrhea.
There's no storage. Yeah. So that's what a person might have
Yeah,
after
complications.
having the gallbladder
Possible
removed,
complications.
which is the reservoir for all of this bile that's used to help digest fat. Well, now there's no reservoir. It's just always flowing through. So they might have.
Diarrhea.
And if they had a fatty meal and they don't have a reservoir, all they have is whatever bile happens to be there, they might have diarrhea from the undigested
Yeah,
fat.
yeah, from that too. Yeah,
Okay, so
both can give you diarrhea.
you'd like to keep the gallbladder if you can. Let's see what you
Yeah, it does serve a function.
There you go.
The surgery is fortunately really easy and common. So in good hands, it's a very easy recovery. It's done laparoscopically, meaning they poke a couple holes in you and do it through cameras and tools, and then they typically pull it out through a bigger hole. So you just have these small holes that heal up really easily.
It's rare for them not to open you up anymore.
Yeah.
Laura Barzyk says, my mom's were the size of root beer barrel candy.
Oh, never eaten that again.
Strange.
Thanks.
You ruined root beer barrel candy.
Just kidding. I love root beer barrel candy.
I know what that
You're not
is.
going to ruin that one for me.
Laura Barzyk, sorry to hear that. And then Sandra Cragen says, some of mine are huge. I can feel them.
I think that was a person with 200. You can feel them.
I wonder what they're feeling.
They're like rocks rolling around in there. If I go this way,
I was going to say, you remember the model there and how far it was under the liver. I'm wondering how you're feeling, though.
Well, maybe she's feeling symptoms. Like,
Oh,
like
maybe
she
that's
actually
it.
gets,
Oh, okay,
eats
that-
a fatty
that
meal
could
or
be.
something. And
All right. Okay, is
Starts
this the
to
part
heal.
of the show where we discuss?
oh,
Oh, we never went over. There's two types. There's pigment stones that are green, and there's
yeah.
cholesterol stones that aren't, and most of them are pigment stones. Most of them. I don't remember.
Boy, I couldn't tell you at this point in my career.
We should know that for the show. Anyway, there's two major types.
When I talked to my
Okay.
surgeon friends, and
stones.
they asked me that because
I can think of two we haven't talked of.
yeah, I can think of one. Are we talking about stones? Okay, yeah, I can think of two.
I mean okay, stones that
Yes.
can cause symptoms and can be removed.
Okay, I can think of at least two more.
I had another one. What was it?
Are we gonna consider? I
No,
mean,
don't
like
s-
something that says
don't-
lit that has the name Lith in it, right?
Right.
Okay, all right. So
Well,
you wouldn't consider
That
like
that you can actually that you know comes the specialist can take out. Let's say that.
well, one of them
and fix
you've
it.
taken out on YouTube. That's the one I'm thinking of. One of the ones I'm thinking of.
Oh yeah.
Okay, so which one of yours am I not thinking about? Okay, so we each had two.
So you're talking about tonsillitis,
Cialis, tonsillits.
Cialis, and then my last one was Bezors.
Bezors. That's
Nice,
not.
huh?
Oh, okay, you win. Because I was thinking of umbilicalith.
Oh, we tied.
Okay, hey, there you go.
Umbilicalith.
You took it out on YouTube.
So yes, I was going to say you
Look
can
it up.
you can put in Auburn Medical Group umbilicalith and see that. You can put Auburn Medical Group and tonsillith, and those are stones that we've taken out.
Yeah, tonsillits.
That's funny. I didn't even think of those two that
Yeah.
I've done.
Bezors. I didn't even
and
register
Cialis-
because Bezor doesn't have lith in it.
But it is essentially like
yeah, you're
okay.
right. But
So,
didn't even register.
Cialis is a stone in the salivary duct, and usually people will have pain with having sour foods. It'll be painful
Yeah.
in the
Parotid
usually
area.
the parotid glands, and
It can get swollen. Actually, it can get really.
so we actually tell
Big
people
and
to
swollen.
eat sour candy to
Yeah,
just
suck on some lemon
force
drops.
it out. Again, they can get affected and have to be removed surgically.
Yep.
That would be bad. Okay,
There you go.
all right, let's go to the comments before we wrap.
There we
up.
go.
Alexis
Hopefully
Bragg
we answered
says,
all of your questions regarding
I hope
gallbladder
so. Worst
disease.
pain of my life, had to have my gallbladder removed with all 80. Another one with extreme number of
Dozens.
stones.
Dozens
Yeah,
of
that's-
stones.
Wow.
That's impressive.
Wow.
Yeah, it's like a bag of marbles in there.
Probably, it really is. Yeah. Life is better after the stone removal. So we wish our family member the best recovery.
Sounds like he's doing well. We checked in today.
And thank him for making for great fodder for us to make a lot of jokes about and laugh about.
No, we appreciate you. We love
Yes.
you.
So you know it's better to be our patient than to be related to us. We're better to our patients than our own.
There you go. There you
So
go.
anything else you want to announce out there?
I don't think so.
Special thanks to Lindsay Twine. You
Thank
too
you.
can have your name at the end of the video somewhere over in
And
front
Laura,
of
we've
you.
got to call you out. 'cause
And Laura,
you
oh my
had a
goodness,
nice,
Laura. Wow. We are
super chat.
set because of Laura. So until next time, Dr.
Dr. Wayne Vaughn.
and Dr. Mark Vaughn telling all of you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.